Okay, Dr. Lorrain again. This time we're going to talk about strategies and what we coach parents around for interventions in the office. So one of the most important things to do for intervention is to pick a name for what you want to call the worry. I've had kids call it scaredy after scaredy squirrel. I've had other kids call it worry dragons or worry bugs. We have kids who call it brain leeches. Some kids, even young children, will like the name anxiety or worries and to frame it that way. The one that we often recommend is to call them porcupines. Porcupines most kids can relate to and are an animal that kids seem to have some warm and friendly feelings with, so it seems like a really comfortable way to describe the anxiety for them. The reason porcupines is such a helpful metaphor is because porcupines are an animal whose quills go up automatically as soon as something happens. A little bit like children's very prickly brains who feel danger or feel scared in situations that may not warrant it. Like porcupines, children can be taught to calm down and evaluate the situation and see whether they should fire those quills and do something to panic or get out of that situation, or whether that situation is actually something that's safe. The second strategy for helping children with anxiety is to give them something to motivate them. So you could say something like, the porcupines are back and they're trying to take over your brain and make you miss out right now on playing Play-Doh, or on going to have your bath, or on having a dance party with mom and dad, or something really fun. So we need to get rid of the worry dragons or the porcupines so we don't miss out on something in life. The third thing to do is to give your child something concrete to do to try to help the worry go away. We usually separate that into two separate kinds of things. So one would be breathing strategies, and one would be physical strategies or games they can play. The first strategy that we typically recommend to families is something called candle breathing. So we will actually encourage parents and children to put up a finger like a candle in the office and take a big breath in. Essentially, we want children to pretend that they are blowing out a birthday candle. A lot of children under the age of 3 really can't do that on their own, and it's probably the parent modeling the candle breathing for them. If children really like this strategy of blowing out birthday candles or a candle, these strategies should be practiced when children are calm and settled. We need to help the brain remember these strategies and learn them when children are calm. If they don't have those strategies fairly significantly wired up into their brain, that will be unlikely when they get anxious that they will try those strategies. Even if the children themselves won't do the strategies when they're anxious, it's really important for the parent to do the strategies and sort of support them with them. So often we could put our fingers sort of between ourselves and our child and pretend to blow the candle out together, even though our child might really not be participating. The other thing for breathing that we often do is bubbles. Parents may not want to do bubbles inside the house at this time of year, but if you have a hardwood floor or something you can wipe up, or tile in your kitchen, you could always go blow bubbles in the kitchen. Blowing bubbles also helps children regulate their breathing and takes the focus of the brain off the anxiety and onto the strategy of actually blowing out their breath. So it stops the hyperventilation and helps the nervous system calm down. One of the physical strategies that we like to recommend is something called sticky hands. So we tell our children to pretend there's glue on their hands and that their hands have gotten stuck together with the glue. And we ask them to really pull and squish and move their hands and try to pretend that they're going to pull their hands apart and get that glue off. It also helps calm the nervous system because we're doing a physical game or activity to really move those muscles in our hand. Some children really appreciate when parents go firmly put pressure on their shoulders. It's a grounding activity that can really help calm the whole nervous system. Other children would find any sort of physical touch in those moments actually escalates them and makes them more anxious. So families could go home and play with that. Kids yoga is another form of physical sort of body positions that also involve breathing. So there are things like cats and cows and bridges and crocodiles and various different fun yoga poses that parents could try with their children. So you could say something like, the porcupines are back and they're trying to make you miss out on finger painting, so let's go do a crocodile pose and a cow pose and see if we've made the porcupines go away so we can keep going and enjoy our finger painting. One of the most important steps to do at the end of all of that is to really help children understand how successful they've been. So half an hour later, you could say, wow, look at all these beautiful pictures we finger painted, or look at all this fun we had with Play-Doh. Isn't it wonderful that we fought the porcupines and made the porcupines go away so they wouldn't take over our Play-Doh? The more we do those things, the more it helps tiny young brains understand that they can fight back against this and do something to make things better for themselves. If we give in to anxiety and we focus on the anxiety, the more we talk about anxiety, anxiety grows, and we tend to have children who have bigger and bigger worries, and it consumes more and more of their life. The more we teach young children that they can calm down and make these worries go away, the more successful they feel, the more the worry shrinks, and usually the less it gets. Thank you.